So in this PowerPoint contain few question and answer. Question number 1, a client with chronic renal failure who received hemodialysis 3 times weekly and has a hemoglobin level 7 gram per dl. The most therapeutic pharmacological intervention would be administered. So when you read this question, we have to find out this patient has a chronic renal failure and patient under hemodialysis. We see the hemoglobin is below the normal range. What are the most therapeutic pharmacological intervention for this patient? Number 1, ferrous sulfate. Number 2, apotin alpha. Number 3, neuropogen and enoxaparin. So correct answer is apotin alpha. Due to some unknown reason, NCLEX board like this question to repeat again and again. So from this question, we learn if patient has a chronic renal failure, means kidney does not work. Kidney can produce a hormone, it is called erythropoietin. The erythropoietin most important for formation of the red blood cell. Kidney does not work, so no more erythropoietin, so does not formation red blood cell, so hemoglobin level go down. So we have to give something like erythropoietin. What is? We use apopoietin alpha. A restaurant said chronic renal failure diminished the production of erythropoietin by the kidneys and lead to a subnormal hemoglobin level. So if you ask me what are the normal range of hemoglobin, it would be 13 to 18 gram per dl in case of men. In case of female, it should be 12 to 16 gram per dl. An effective pharmacological treatment for this is apopoietin alpha, a recombinant erythropoietin. Because the client anemia is caused by a deficiency of erythropoietin and not a deficiency of iron. Administering ferrous sulfate would be ineffective. Neither any other drugs are used to stimulate the neutrophil or nor enoxaparin will raise the client hemoglobin level. What next? A client being treated for complication of chronic obstructive pulmonary disease needs to be intubated. The client has previously discussed his wish to not to intubated with his girlfriend for 5 years, whom he is designed as his healthcare power of attorney. The client children want their father to be intubated. The nurse care for his client, know about what? So number 1 said that client commonly confer the healthcare provider of attorney on someone who share their personal values and benefit. Number 2, the client girlfriend is responsible for national legislation regarding the surrogate decision maker. The children's biological relationship with their father supersede his girlfriend's wishes, or healthcare provider must honor the children's wishes to avoid a lawsuit. What is correct answer? Correct answer said a client commonly confer the healthcare provider of attorneys on someone who shared their personal values and belief. So this question about the advanced directives, right? What is advanced directives? So advanced directives are written instruction recognized under the state of law that are related to the provisions of care a person wishes to have when he or she cannot make the decision themselves. It would be living will or duration power of attorney or healthcare proxy. Advanced care medical directives is a competent client consult with the healthcare provider and specific kind of medical care they do or do not want in specific scenarios. So like here we can see the patient girlfriend wants something, but patient children do not like it. So what are the rationale? The healthcare power of attorney is someone who are make a decision when the client cannot. The client tends to select individuals who share their personal values and belief as their healthcare power of attorney. The family members and designed surrogate does not always agree. The state laws regarding the surrogate decision makers may differ. The legal rights of a healthcare power of attorney in regards to healthcare decision, those are family members, right? So the law designed the healthcare power of attorney as person to make the decision. So next question. A charge nurse is making arrangement for elderly client newly admitted from emergency department for treatment of suspected pyelonephritis. Pyelonephritis means inflammation of parenchyma of the nephron or pelvis. So the charge nurse note that the client has been assigned to a semi-permeable room. So these two clients have to share the room with another client who has the same last name. What should nurse do first? So two patients that they both of them the last name is same. So if you do not give them separate room, the chance if you give them same room or cohorting in the sharing the room, the chance of make the error. To prevent that kind of error, it is good to give them two different rooms. So number one, make sign to alert the staff member that both clients in the room have the same last name. Number two, ask the admission department to assign elderly client to a new room. Number three, ask the client if he had been willing to answer to a different last name. But it is not it does not make any sense. I changed my last name or alternative name. Number four, verbally remind the staff to check each client identifications bracelet. But when in emergencies, so many patients At times actually we forget to remind verbally or alert the staff member. So it is good give them or ask the admission department, give them separate room. So correct answer is number 2. Ask the admission department to assign elderly client to a new room. Rational said to prevent the error. The change the nurse should ask the admission department to assign the elderly client to another room. Making sign or verbally alerting staff member do not eliminate the risk of error. It does not appropriate ask the client if they change their last name. Next question. Which steps should a nurse follow to insert a straight urinary catheter? So what is the normal procedure we have to follow when we insert urinary catheter? Number 1, check the sterile field. Then drape the client, clear the meatus, clean the meatus, and insert the catheters. Right. Number 2, put on gloves, prepare the equipment, create a sterile field, expose the urinary meatus, and insert the catheter. So put the gloves, then prepare equipment. Why not? Prepare the equipment first, right? Then you can wear the gloves. So prepare the client and equipment, create a sterile field, put a gloves, clean the meatus, urinary meatus, and insert the catheter until urine flow. Number 4, prepare the client and equipment, create a sterile field, test the catheter balloon. So why it is here? So correct answer said number 3. We prepare the client and equipment, create a sterile field, put the gloves, clean the urinary meatus, and insert the catheter until urine flows. So rational said, preparing the client and equipment, create a sterile field, putting the gloves, cleaning the urinary meatus, and insert the catheter until urine flow are all the vital steps for inserting a straight catheter. The nurse must prepare the client and equipment before creating a sterile field. Putting on gloves before creating a sterile field or performing other tasks is incorrect. Testing the catheter balloon desired the procedure for inserting a retention catheter rather than a straight catheter. Next question, a client with suspected severe acute respiratory syndrome and comes to the emergency department, which physician order should the nurse implement first? First, number 1, institute isolation precursor. Number 2, begin an IV infusion of dextrose 5% in half normal saline solution at 100 ml per hour. Number 3, obtain a nasopharyngeal specimen for reverse transcription polymerase chain reaction testing. Number 4, obtain a sputum specimen for enzyme immunoassay testing. Correct answer. Number 1. Your patient has a severe acute respiratory infection, right? Infection prevention is the most important of priorities. First of all, we isolate them. Isolate precaution is followed. So Rational said, severe acute respiratory syndrome, shortly called SARS, a highly contagious viral respiratory infection or illness, and it is spread by close person-to-person contact contained in airborne respiratory droplet. The virus is easily transmitted by touching surface or object contaminated with infectious droplet. The nurse should give top priority to instituting the infection or control measure to prevent the spread of infection to emergency department staff and client. So after isolation measures are carried out, the nurse can begin other procedure like IV infusion of dextrose 5% in half, normal saline and obtain nasopharyngeal and sputum specimen. Next question here. While receiving heparin to treat a pulmonary embolus, the client passes bright red urine. What should the nurse do first? Number 1, decrease heparin infusion rate. Number 2, prepare to administer protamine sulfate. Number 3, monitor partial combustion time. And 4, start IV infusion dextrose 5% in water. Next answer is number 2, prepare to administer protamine sulfate. What is rationale? So frank pain or frank hematuria. Hematuria means urine mixed with blood, include excessive anticoagulant and bleeding. Also, it may be because of heparin overdose. The nurse should discontinue heparin infusion immediately and prepare to administer protamine sulfate, the antidote for heparin, which is antidote protamine sulfate. Decreasing the heparin infusion rate would not prevent further bleeding, although the nurse should continue to monitor partial thrombin time, and this action should occur occur later. An IV infusion of 5% water may be administered, but only after protamine has been given. Next, a nurse administer albuterol is ordered to a client with emphysema. So a patient has emphysema and he or she prescribed bronchodilator like albuterol. So which findings indicate that the drugs is producing a therapeutic effect? Means the drugs is working. Bronchoconstriction, which one causes bronchodilation and normal respiration. So number 1, respiratory rate is 22 beats per minute. Number 2, dilated and reactive pupil. Number 3, urine output 40 ml per hour. Number 4, heart rate 100 beats per minute. So salbutamol, as I told you, causes the bronchodilation. When bronchoconstriction means disease, give salbutamol or albuterol. Bronchodilation means patient has normal respiratory rate. It is 22 beats per minute. So Reginald said in a client with emphysema, albuterol is used as a bronchodilator. A respiratory rate 22 breaths per minute indicate that the drug has achieved its therapeutic effect because the fewer respirations are required to achieve oxygenations. Albuterol has no effect on pupil or urine output. It may cause change in the heart rate, but it is not a adverse, not therapeutic. Next question. A client admitted to the unit with a diagnosis of end-stage renal disease is scheduled to undergo hemodialysis. He voices anxiety over shunt placement and management of care at home. A nurse initiates a referral to which members of the interdisciplinary teams. Number one, physical and occupational therapist, dietitian, and home health care. Number two, home health nurse, nutritionist, and social worker. Number three, physicians, physical therapist, and family. Number four, dialysis nurse, physicians, and family. Correct answer is number two, home health nurse, nutritionist, and social worker. Rationale. Home care for a client with end-stage renal disease required ongoing education and referral. Team members include the home health nurse, nutritionist, social services in the process. The home health nurse assists with the client teaching and support, also completion of physical assessment, and also evaluation of outcome. The nutritionist explain dietary needs and necessary change in the diet. The social worker assists with findings, resources, and provides the counseling and support to the client and family member. Physical and occupational therapy and dialysis are not component of home care. Family members are not the part of interdisciplinary healthcare team. What next? So a client comes to the emergency department and complaining of sudden onset of sharp, severe pain in the lumbar region that is radiate around the side and towards the bladder. The client also report nausea and vomiting and appears pale, diaphoretic, and anxious. The physician's tentative diagnosis the renal calculi and order flat, flat abdominal X-ray. The renal calculi can form anywhere in the urinary tract. What is their most common formation site? In the kidney, in ureter, in bladder, and urethra. The correct answer said the kidney. So if you read this question, what is the typical nature of renal stone pain? And if you read it, sudden onset sharp, severe pain in the lumbar region that radiate around the side towards the bladder. And the client also report nausea and vomiting, appears pale and sweating and anxiety. So it is the typical nature of the renal stone. We diagnose by abdominal X-ray, So Rachel said the most common site of renal calculi formation is in the kidney. Calculi means stone, may travel down the urinary tract with or without causing the damage and lost anywhere along the tract or may stay within the kidney. The ureter, bladder, and urethra are less common site of the renal calculi formation. What next? A client with influenza is admitted to an acute care facilities. The nurse monitored the client closely for complication. What are the most common complications of influenza? Means flu, septicemia, right? Pneumonia, and meningitis or pulmonary edema. So when infection not treated, it spread out to the blood, right? We call septicemia, then lead to the sepsis, lead to the shock. If infection spread to the lungs, patient develop pneumonia. If infection causes the meninges, we call meningitis, and pulmonary edema is a complication as well. So correct answer is the pneumonia. Why? Restaurants said pneumonia is the most common complication of influenza. So we learned today, if anybody have influenza, if it is untreated, it lead to the lung infection we call pneumonia. So it may be either primary influenza, viral pneumonia, or pneumonia secondary to bacterial infection. Other complications of influenza include myositis or exacerbation of chronic obstructive pulmonary disease if patient have. Also, Ray's syndrome, myocarditis or pericarditis, transverse myositis, or encephalitis are very uncommon complications of influenza. Although septicemia may arise when any infection becomes overwhelming. So if infection is spread out, it gets inside the blood, and we call septicemia, which is lead to the sepsis, and sepsis lead to the septic shock. So meningitis or pulmonary edema are not associated with influenza. This is few question and answer with information. It helps to prepare the NCLEX exam.